am going to talk all these things. First one is spontaneous. I am speaking, but he is not responding. That is, the eye opening is not happening. Now, based on the speech, I am asking hello like that, but he is not opening. But now I am going to give a pain response. How can we give a pain response? As in the road, but if we are having any type of pain or anything, we can pressure onto the pain areas like this. Yes, the eye opening is active here. Now we can give the score as 2 for the eye opening. Based on the eye opening, this 2 point is scoring for the patient. That is our model human. Now going for the second category for the verbal response. Now we are having a verbal response for 5 areas, and I am asking certain questions to this model. Now, what is the name? Okay, we can see the confused state of analysis. So we can give, what is this? This is a 4 score. Okay, so here we gave 2 and here is 4. If we join this, we got the score for 6. Now going further, the last stage, that is the motor response. Now we are going to say 6 stages of motor response in the Glasgow Coma Scale is present. Now, he's obeying to the command. Get up. The obeying the command is negative. Now, localize to the pain. So he is having to the pain, and I am going to give withdrawals to the pain and abnormal flexion and the extension. So we are going to implicate these things with the pain sensation. Based on the pain, whether the motor response is working or not, we are going to see. So I am touching his arm. This arm is completely bruised based on the accidents and bruises or anything. Now I am touching this arm. No, he is going for the withdrawal signals. He is not going for the abnormal flexion or abnormal extension or localized to the pain. He is going for the withdrawal to the pain. I am touching his arm that is completely bruised. He is taking away from me. So this scores of the 4. Combining all these things, eye opening, motor response, verbal response, all these 3 combines to form the moderate brain injury. And this type of cases is in the partial stage, either the area of the brain which may get affected, and the first line of treatment of admission in the emergency ward is most important. The care of transferring the patient from the road or any type of area to the ambulance is most important, as we need to give better care of transferring the patient. As we have to learn how to transfer the patient, we need to follow the techniques in the transformation. Okay, so if I am pulling out his leg like this, if I am holding his leg and taking, if the spinal cord is going under any type of compression, it will lead to spinal cord injury. If I am taking his upper body against to the focus, if cervical area is going for any type of compression, this will lead to quadriplegia or life-threatening, maybe leading to the death. The care of transferring is most important. And the first line of treatment, as we all learn in the clinical neuro, what type of drugs we need to give to the patient in the first line, and the physiotherapy treatment we need to analyze. So these techniques will be worth value in analyzing the treatment. As a physiotherapist, maybe we might not in the first line of analysis of the assessment, but we need to be very sure of the Glasgow Coma Scale in analysis. As all the things are changing, syllabus are changing, we might be placed in the first line to assess the coma patients for the better clarification. So this is about the case presentation video and physiotherapeutic approach for this patient after proper drug medications and proper ICU management. We need to go for the physiotherapeutic approach. That is picking up techniques or VR therapy or any